Well, good morning or good afternoon, good midday, good evening. My name is Shubayan Sanatani, and I am your host of the Let's Talk SADS Live Canada, a webcast that we've been bringing to you since the beginning of this year. And we've had quite a series of guests and topics, and I'm really excited about this month's guest. I'm a little discombobulated today. It's that weird time of year where we're transitioning from summer to fall, and I've got a new computer, so I'm not even sure if I'm looking at the right screen right now. But in keeping with that back to school sort of sense, we also know that we are here for learning, and this is a collaborative learning environment. And we welcome your comments and your questions. We don't necessarily have the ability to solve your specific personal health questions, but certainly are interested in talking about SADS, sudden arrhythmic death syndromes conditions. I'm very grateful to be here, really through the energy and the ingenuity of Pam Husband, the director of the Canadian SADS Foundation, and Evan Kruger, who's our behind the scenes tech whiz, and of course our good friends at the American SADS Foundation, Alice Lara and Aaron Waite and Michael Ackerman and others who are all helping us put things together. If you see me glancing down every once in a while, it's because my keyboard's also been moved. So everything is topsy-turvy. So you'll remember the last few sessions, we've talked about a very exciting fundraiser, and we are now at the time where the registration is open. And I must say, when I first started hearing about this idea, I wasn't really sure how it would work. How could an auction work across a country as vast as ours? But they have pulled it off, and registration is now open. And on your screen is a QR code, so you can take a picture of that and register. We're all really good at that because half the restaurants still make us upload menus to order things. So take a picture of that. It's also on other platforms, Facebook and Twitter or X. And so you scan the QR code. You must register, though, to be part of this auction. And certainly we are in need of funds in order to keep doing what we're doing. And we want to really expand what we're doing. My goal is to be able to get to some in-person interactions, maybe as early as 24, but that is just around the corner. So we definitely want you to share this with your friends. Here are some of the really cool things that you can bid on. A 14-karat sapphire and diamond ring valued at almost $2,500. So quite a beautiful piece of jewelry. Ottawa Senators tickets. The hockey season is just getting started. I saw the improbable Canucks victory on the news this morning. Some other things here right in the middle is something we're going to be talking about today, an automated external defibrillator, or an AED. And we're going to talk a lot about that this morning with our guest, but certainly something that I think bidding should go heavy on. Calgary Flames tickets. So obviously, you can choose what city you want to support. Now, today's webcast is also supported by two sponsors, Action First Aid and Save Station, and I encourage you to go check out their websites. Both organizations really in favor of supporting CPR and automated defibrillators. Now, before we get on to our topic, you'll remember that I've tried to put a little bit of a Canadian stamp on this, and so we've been bringing Canadian fun facts. And here's just a reminder of some of the people we featured in stories. In the bottom right there's the invention of insulin, which is a Canadian contribution. Last month, it was a slightly different theme. We talked about the Hospital Insurance Act, because we talk so much about healthcare and how it is funded, and is Canadian healthcare as it's currently structured, is it going to endure? And then, of course, I featured Tim Horton, who is a well-known Canadian icon for several things, mostly shops now that bear his name. But and probably a lot of you are wondering what we're doing with this trivia. I did promise that we're going to have a game. So later this fall, we are going to reveal the game, and there will be a prize for the winner. Now, it took a few months to come to this very famous, probably one of the most famous names in Canadian medicine. Again, this is a photograph from the early 1900s, and this is Sir William Osler, and he's very well known, of course, to all of us who practice in this field of healthcare, not just in Canada, really worldwide, and is one of the founding fathers of Johns Hopkins in Baltimore, which of course is a huge inherited arrhythmia center of excellence, among other things. But so this Canadian physician was a real pioneer. And one of the things he's most known for is, in fact, bringing the medical learner, the med students, to the hospital wards, to what today is known as rounds. And so taking the learners out of the classroom and bringing them to the patient. And this concept where the patient knows the story and tells the story really started with Sir William Osler. We could spend a whole session talking about that, his legacy. And so he is our Canadian trivia contributor today. So only slightly less famous than William Osler is our wonderful guest today, Dr. Katherine Allan, or Katie Allan, as she is known by. And we're going to be talking about building safer communities and the role of CPR and AEDs in schools. Now, we are going to talk a bit beyond schools also, for those of you who are interested in CPR and AEDs in the community. This is also very much for you. And Dr. Allan is a mixed methods researcher and has done a lot of work in this space, has been in an important role, not only doing the research, but also in advocacy, and is a co-founder of CARE, a grassroots organization in Ontario that we're going to also ask her about. And very recently has taken on a position in the Office of the Chief Coroner of Ontario as the Family Genetic Care Associate, which is another thing that we're going to ask her about. So we're going to ask her some hard questions about her personal life and to help us understand things. So without any more delay and me chatting, if we could bring Dr. Allan into our studio. And
hi, good morning.
Welcome, Dr. Allan. And I'm gonna be very messy here because I'm used to calling you Katie. So forgive me if I go back and forth a little bit. It's so
totally
nice.
Fine.
And you're joining us you're on the road. And so thank you for taking the time and joining us today. Really appreciate it. I've been looking forward to this conversation. I had the privilege of reviewing some of your papers and just a big fan of your work. So as I was hinting at in the introduction, you've founded an organization called CARE, and you've recently taken on a role in the coroner's office. So tell us a little bit about you and how you got into this, as one of Canada's leading, CPR and AED advocates.
Sure. Great question. I guess it all started when I was doing my PhD. And as part of that, I was interviewing families who'd lost a loved one to a heritable heart condition. And I really wanted to understand how much they understood, about, why their loved one's heart had stopped. And also, if it was heritable, did they understand that they were also potentially at risk and needed to go for screening? And so, after speaking with many different families, oftentimes the answer was no, I still don't know why my loved one died. And B, I didn't know I was at risk. And so, as someone working in this space, I was absolutely horrified that this was happening, and sort of went back to the coroner's office trying to understand, what was going on. And this kind of sparked my journey into and where I am now with my role in the coroner's office. Um, and then with CARE, founding that, it was actually due to Alan and Debbie Corrins. I'm not sure if you know them. They lost their son, Alex, back in 2006 to a sudden cardiac arrest. He was playing hockey. And they themselves have been very instrumental in trying to get, an advocacy work, trying to get the government to sort of mandate awareness about cardiac arrest in these conditions. And so they approached me in 2018 and said, hey, we want to try and go, to the provincial government again and try and get this passed. And so it sort of sparked a larger conversation about not just that, but what's bystander CPR rates? Are kids being trained in schools? And so, just the four of us sort of talking together, that started a conversation. And then now we're over 60 members all across Ontario, many different paramedic agencies. We work with Heart and Stroke, Canadian SADS. And yeah, just passionate about, raising awareness, increasing rates of bystander CPR and AED accessibility. So I guess, yeah, that's kind of my journey.
Wow, a lot of experience in these very tricky conversations and challenging. The role of advocacy in Canada is not easy. There are so many healthcare priorities that SADS and CPR and AED are competing with. It sounds disappointing to say it is a competition, but there's only so much that any government or any public body can take on. Now, any plans to maybe take care beyond Ontario? We don't want to put you on the spot, but and I don't want to add to your work, but I mean, it sounds like a great organization.
Yeah, no, it's a great question. I mean, I have spoken to, I know of, other individuals in different provinces who are all in this space and have this interest. We have talked maybe about a national kind of AED accessibility coalition. I guess the problem is that healthcare is provincially funded and legislated. So it's really hard to have, what if we go to the federal government or we have a federal advocacy, what would that look like? What would be the priorities? And then how does that actually trickle down to provincially? I guess for me, part of it is I'm not sure I have the time to go after something like that. If there's anyone who's interested and wants to volunteer, I'd be happy to help. But for me, it just seems a very large, nebulous thing that I'm not sure I have the time to be able to tackle right now. Someday, maybe.
Yeah, no, fair enough. The in Ontario's, a little shout out to our partners in Ontario, the coroner's office there have been very engaged in the conversation. Really, one of our favorite provincial jurisdictions. That's a little sneak teaser for our guest for October. But now, I'm going to get on one of my soapboxes here just for a moment. People, especially right now in the SADS space, people are talking about cures and genetic, gene therapy, and we're going to, give you something that stops your arrhythmogenic cardiomyopathy. So it feels, or it could feel like, why are we talking about CPR and AEDs? Isn't that kind of giving up? And I have a very strong view of that. And when we were talking, you were telling me just the other day on your commute, you had a very real life experience. Tell our viewers a bit about that, if you don't mind.
Sure. Yeah. So last week I normally take the local train downtown, and I arrived at the station, and I was sort of going up on the platform, and I saw all these people sort of huddled around a person who was on the ground, and I didn't really understand what I was seeing, and then I overheard one of the employees sort of say, "Oh, we have the defibrillator on this person." So I went rushing up to kind of see what was going on, and thankfully, there were two individuals who'd kind of taken charge. I'm pretty sure they were healthcare providers who were at that point struggling with the AED and trying to get the pads connected and sort of struggling with that. Thankfully, they did get them attached, and they shocked him right away, and then started CPR and shocked him again. And at that point, fire and EMS showed up and kind of kicked all of us away and said, "Go away." And then there was a train in the way. So I was on a different platform, so I couldn't see what happened. I did hear that potentially he did survive, which is amazing because, everybody there did exactly what they were supposed to do, from the time that I think this individual collapsed. And so he has the best possible chance at survival. So, but it was quite sobering to see that, in real life, and this is what I research all the time, right? To see that in action. So.
And it's just like that. And so many of our audience have experienced just that, the suddenness, the unexpectedness. It's on what seems to be a normal day.
Mhm.
That individual was probably, going about their usual activity. So, and 50% of cardiac arrest in the young population, so the ones where we really think about the SADS condition, don't have an etiology or a cause necessarily figured out. And then even in our patients who are living with SADS conditions, we know that there are sometimes breakthrough events. So CPR and AED really they're a foundation of our, our work in the SADS space. So let's ask you a little bit more. Now, I really, I tried to track a bit of your journey. Some of your early work was actually just about how to do CPR. It seemed like the rate of compressions. And I think the finding was, around 100. And so right back. What I found very interesting, though, is it really also matters where you live. Tell us a bit about what you've learned, over the years here. I'm sort of doing your work a disservice and cramming decades of thoughtful research into, give us some sound bites about, which postal code you want to have a cardiac arrest in.
Yeah, no, great question. So we looked within the city of Toronto. We mapped all the cardiac arrests that occurred over a number of years across the city into neighborhoods, to kind of see, where there might be hotspots. So where there's more cardiac arrests, areas where there's less cardiac arrests, and then we dove a little bit into the factors as to why that might be. So areas where there were high numbers of cardiac arrests, there was more like, so lower socioeconomic status, less education, things like that. And then areas where it was high, it was the reverse. But it wasn't sort of true across the entire city. It's a lot more complex than that. There were some areas that didn't have those factors involved. And why is it basically you're just crossing the street, and you'd have, really high risk in one neighborhood, and you just cross the street and then it's really low. We didn't have good answers for that. I really think it would take boots on the ground kind of going in to get a flavor of those neighborhoods to really understand why, there's a lot more in one versus the other. So I think that was, for me, was the big message, was that it's a lot more complicated than we think, right? It can't just be broken down into the usual, like, age or sex or education level or income. It's a lot more complicated than that.
Yeah, and the deployment of these, having an AED in a location is not really useful unless people know that they're there and are going to use them.
Mhm.
Now, we did promise in our back to school mood, and it does have, certainly out here in Vancouver, we do have a bit of that back to school weather where it just feels a little bit chillier in the morning. Now, some of your work in the schools is so important, and you know, do Canadian, well, first of all, do high school, or do people in school in Canada learn CPR? I don't, what have you found out about that?
Yeah, no, it's a great question. As far as I'm aware, there really isn't a again, because education falls under sort of provincial mandate. We did look into this, and it doesn't seem like it's provincially mandated in a lot of provinces, or they don't really have a policy about it. In Ontario, actually, it has been included in the curriculum since 1999. But if you actually look at the curriculum, it's one small paragraph. It kind of gives an example of how to sort of perform CPR using not even the proper equipment. There's no directions about what should be covered, what is certification, all these things. So, if you don't have a lot, and there's so much they have to cover, in the curriculum over the course of a year, and they can't fit everything in. So, we did a survey a couple of years ago of Ontario schools to kind of get a flavor of how many of them are actually doing this, who should be doing this in terms of high schools. And 60% said they were. In high schools, 100% of them should be doing this according to the curriculum. So, so something needs to change, obviously. And hopefully with, there's some stuff coming down the pipes. We hope will help to increase the number of kids that can be trained.
I love the title of one of your manuscripts. I'm going to read it out here. Mandatory training is not enough. The state of cardiopulmonary resuscitation and automated external defibrillator training in Ontario schools. Very provocative. So, clearly saying, you should do this isn't translating into real results. And I imagine that a lot of our high school graduates may or may not know how to, do CPR, or may not be comfortable with it. Are there some opportunities that you identified in that work, or other time points? People often say, well, what about if you renew your driver's license and you got to do it? There's a few there's a few of these time spots, or tie it to your registration for voting. But what are some of your experiences when you have looked at the systems around this?
Yeah, no, great question. And actually, that's part of what we've been talking about at this meeting I'm at. I think part of the issue has been, requiring that people get certified in CPR, because that takes time, that takes hours of time. You have to pay for it, so that causes problems with accessibility and making it equitable. So I like to get away from this idea of certification. I think we need to embrace, it's all about education and awareness, starting with even just bite-sized chunks, like watching a video on the web as a start, and if you have time, maybe doing a little bit more, like an actual sort of educational module where you get some practice. And then, not to say that certification doesn't have a time and place, it absolutely does. But I think when we require everyone to be certified, that causes a lot of these barriers. And it's a big one for schools as well, right? Having to, you have to have a trained instructor, right? So how do you get that? So I think really it's we have to broaden our idea of what education or training or whatever you want to call it is, to get more people engaged, and just different formats, different time points. We need to, look at the countries that do it really well, the Scandinavian countries where they have tied it to driver's ed. It is legislated in schools, and they have bystander CPR rates that are 70, almost 80%. And here it's like, at best, maybe you get 35 to 40%. So how do we get there as a society? And I think really the conversation starts around, like just making it way more accessible than it is right now.
Absolutely. And I think that's, where, the, Canadian SADS Foundation and Heart and Stroke and organizations like yours have a real opportunity to unite and say, let's push the national rates up. And again, like, I can't emphasize it enough. Let's take a condition like long QT syndrome, for example, which is, fairly well known. It's an electrical abnormality that can cause your heart to stop. When we're having conversations with those children and those families, and we say, well, what are we allowed to do? Well, first of all, we aren't the ones that say you are allowed to do, or not allowed to do. But our question is always, what's your safety plan? And, if you're out on the soccer field and you're not feeling good, what's your safety plan? And who on the team has the CPR awareness? Who has the AED? And to really just normalizing that, not just for our SADS family, but making it a very Canadian thing. And it's interesting, to note that hockey rinks were one of the first priorities. I think the Heart and Stroke and the federal government partnered on getting AEDs into hockey rinks because it is such a national pastime. That said, I would say that most of us are not involved in cardiac arrests in hockey rinks as we are in the communities. Now, going a little bit into the weeds here on the schools and the CPR. You've partnered with Heart and Stroke. One of your another great title was, taking the man out of mannequin, I think, to really make CPR more accessible. What about the AED component? Are AEDs now, are they just part and parcel with CPR, or are you trying to bundle, or are we focusing mostly on CPR and AEDs are a separate investment?
It's a great question. I think they should be parceled. I mean, we know that AEDs are hardly used. It's less than 5% of the time AEDs are actually used in a cardiac arrest. Unfortunately, I think most people don't know what they are, don't know where to find them, and then think, oh, I have to be trained to use them, when really anyone could use one. So I think there has to be a push on both of these. I'm hopeful with, in Ontario, the Ontario government passed Bill 141, which is mandating a provincial AED registry. And once that goes into effect, all AEDs will have to be registered. And so that means the public, and especially 911 EMS, will know where they are, and that hopefully, increase awareness about that. And at the same time, hopefully there'll be a public awareness campaign talking about AEDs, how easy they are to use. Don't be afraid. But it's definitely a big challenge, I think, these things. But hopefully, with lots of smart people are working in this area, we'll come up with solutions about, just making people more aware, I think is the first thing.
Yeah, no, absolutely. And that concept of having a registry, so there's some, data about, presumably, uses when it's been deployed, and the other things, sort of, the servicing and maintaining batteries and things. So one does need a bit of a system in place. And I think Manitoba is one of the first provinces to really sink their, commit to this process. So good for Manitoba, and in Ontario now with Bill 141. So these are important steps that are going to put systems into place.
Exactly.
Now, you've also gone into what I think all of us are appreciating is a very important aspect, and I hear it more and more at meetings and in conversations, is the psychological impact of giving CPR to a loved one, or a bystander, as well as the ongoing support that is needed for people who have given some CPR or received CPR. So tell us a bit of the work that you've done in that area, just the whole, the personal experience, the emotional toll of these things.
Yeah, no, I mean, especially, I mean, I can, as a person who witnessed one myself, and I couldn't stop thinking about that individual. I mean, we know, unfortunately, that the survival rate is not great for these things, and so I personally was really worried and sort of replaying in my head. And I know, I think it's one of those things. Do we even tackle that in training when we train people how to do CPR? Do we let them know that there's a good chance that, unfortunately, the person might not survive, and you did everything that you could, and you did it right, and you shouldn't feel guilty, because unfortunately that's just the reality. But that's something I don't think we talk about a lot. We often just encourage and say, we got to do CPR because it saves lives, and it does, but sometimes it doesn't. And we need to prepare people that this can happen. And that there's supports out there for individuals who have, been a lay bystander and helped out with cardiac arrest.
Yeah, no, absolutely. And the world is short on people who are experienced in, providing psychological support. And, I think we're still very much going through difficult times. And so the value of that profession in joining our SADS teams cannot be overstated. And we do often, as physicians and healthcare teams, we focus on the, let's find the diagnosis, and or let's get the defibrillator implanted. But there's a whole ripple effect in the community of the people that were involved in the family. So definitely, the work that you've done in that is so important to remind us of the the people that are at the scene and the family members. So now in our remaining moments, I want to go into some other really personal stuff. So I should point out that that Dr. Allan is a PhD type of doctor. We often joke and say the smart type of doctor. But now, what was actually the subject of your PhD? Like, what was the title of your PhD thesis?
So I was looking at the incidence, so the total number of people who were having cardiac arrests in Ontario, specifically due to a heart condition, and then sort of looking at that, and then the familial inheritance. So we know that these conditions can run in families, which means then family members are at risk, and so that was I sort of looked at sort of trying to track how many of them that there were in Ontario over a time period. And then part of it was also, as I said, interviewing families to kind of get their perspectives on these things.
Really, really innovative at the time that you were embarking on that. And the reason, apart from the fact that I'm fascinated by the work that she's doing and has done, is I just want to remind our viewers, to advocate for supporting our scientists in Canada. I know we're asking for a lot of you this morning. We want you to buy SADS items, and we want you to promote CPR, but we also want you to advocate, because it's the basic scientists, it's the PhDs who are advancing our field. So the only reason that we have a conversation about the new molecule for long QT and for arrhythmogenic cardiomyopathy, or the reason that we know that 100 compressions per minute is the right number, is that there are scientists who are working very hard, writing grants and trying to get their research done in a very competitive environment. So always, if you have a chance to speak to a politician about honoring our scientists, please do. So Now we didn't necessarily give our viewers the three things that they must do before going back to school with their SADS, with their SADS child. So do you have kind of a list of, they're in a new school, what are the kind of things they should be, checking out in their school? Is this how's the math program? Sure, but what's in as relates to the SADS field, are there some key points?
Yeah, I would say for sure, a lot of schools have AEDs that are placed in the schools by the local EMS. I would say find out if your school has an AED and where is it located. I mean, I just had this discussion with my children the other day. It's right beside the office, and my son was like, "We have an AED. Where is the AED?" So knowing where your AED is, asking if your school has an emergency plan, preparedness plan. Like, what happens if somebody unfortunately has an event, whether it's a teacher, a visitor, or a student? Does the school have a policy and knows what to do in those kinds of situations? These are sort of questions to ask of the school, and if not, definitely there's many people I'm sure in the SADS community who can help with that, to help you put together something like that for your school. Those would be my main things. And if you have time, watch a video on how to do CPR. If you have the time and the money, maybe do a course. Those would sort of be my suggestions for back to school preparedness.
Yeah, no, absolutely. And sometimes these AEDs are locked up in a place where, the person that has the key isn't on
Yes,
site. So,
there.
The AED needs to be there, accessible, and awareness. And now, the grade 9 student, generally does not want to have any attention drawn to them. And so, to the parents out there, maybe you can, take a bit of this on, or have your friend talk to the school administration. Most of us are very focused on having our SADS kids just thriving and being in with everybody else, living their fullest life. And it's also important to know what your school's safety plan is. Katie, it's been an absolute delight to talk to you. I feel like we could talk a lot more and get into some really great lessons of the research that you've done and the advocacy. Keep up the excellent work. It's so great that you are really one of Canada's recognized leaders in this space, and through really hard work and dedication. So thanks for joining us today, and really great conversation.
No, thank you so much for having me. It was a real pleasure. And anytime I can help or come back for more conversations, I'd be very happy to.
We didn't even get into some of the future looking things, so we will definitely have you back when we are all talking about drones and AEDs and the James Bond car AED and everything.
Sounds
All
great.
right.
Thank you.
Enjoy your meeting. All right. What a and very humble person about all the important work she's done, which is just wonderful to see. And it's a tough space to be working in advocacy. In British Columbia, we have a huge overdose crisis, and it's hard to not to take anything away from that. Both can be important, but it's advocating and lobbying is full-time work. So I hope you've enjoyed our conversation. I'm going to try and do something technical here. Bear with me. I did say that my new computer, so Evan might have to help me here. I'm going to just show this QR code one more time. Let me see if I can find it. All right, there it is. Okay, so for those of you who might have missed the first few moments, the auction is open for registration now. And so in order to do the bidding, when the bidding launches, you will have to be registered, and just taking a picture of that QR code is one of the easy ways to do it. So I am looking forward to coming back to you next month, which will be after the auction, and hopefully we'll have raised a lot of funds to move us towards some of our hopes for 2024. So thank you so much for joining me, and I look forward to our next conversation.